there's probably very few issues that are going to be decided or debated within states that will have as long of an impact as these kind of efforts to set up these health exchanges. A huge chunk of the American population will ultimately get their health care if this law stays in place, and we're going to assume for the sake of this call that it will ultimately get their health care through these exchanges. And we are delighted to have Joel Ario, who's kind of the quarterback of the HHS effort on setting up these exchanges, joining us. Joel has an extensive state background. He was drafted into this administration from Pennsylvania, where he was the Pennsylvania Health or Insurance Commissioner, and has a background in Oregon as well. Spent 7 years as Chief of Insurance Regulation for Oregon. Extensive background in kind of how states interact with insurance throughout the country for many, many years. Joel now heads up the Office of Health Insurance Exchanges at the Center for Consumer Information and Insurance Oversight at HHS. Joel, we're delighted that you can be with us, and I'll just turn it over to you.
Thank you, Chris, and thanks to everybody that's on the phone today. I am from the state side of the equation here, and the exchanges are an opportunity for the states, I believe, and so I'm happy to join this call and probably have some former colleagues on the call today as well. Let me make 2 points that are kind of good news points to start with here. One is, I think Chris laid out well the challenge that the states face this year. Fiscally, I think there are like 2 states in the country that don't have a budget deficit of some sort to wrestle with. So the very good news in terms of the exchanges are that the federal government is on the hook for standing up the exchanges in the states all the way through 2014. So it's not only between now and the startup of the exchanges on January 1st of 2014, it's also for that full first year of operation that the law is very clear. States that want to develop their own exchanges will get all, quote, necessary funding to do that from the federal government. There is a string, as there always would be, on money, which is the state has to be making progress, is the language of the statute, toward the benchmarks set by the Secretary. So we'll come back to that in a few minutes as to what those benchmarks are. But states are in the driver's seat here. They have the first option to establish an exchange at the state level, and as long as they're meeting benchmarks, they get full funding for that enterprise through the federal government. And by the way, that's money that's not subject to the appropriations process. It's in what we call mandatory funding, meaning that it is available to the extent it's necessary, and to change that would require repeal of the law, and as people know, that's probably not in the cards. So this particular funding stream will stay open to the states, and it's one good reason I think that states ought to take a very careful and serious look at standing up their own exchange. The other good news point is that in terms of people who are on the legislative side of this, what you need to do legislatively this year is not that much. To be advancing your exchange, what you, I think, need to do as a kind of a bare bones way is to take the NAIC model, which takes the federal statute and codifies it in a model state law. The NAIC has been doing this for more than a century, and they did it pretty well in this case, we think. Took the provisions of the federal law, simply codified them in terms of a model law at the state level. Most of you have staff in your different legislative committees who have already worked with NAIC models, and obviously there's some adaptation in every state of the model, but it does provide a basic core model for how to put in law the basic authority to be able to implement a state-based exchange. The one policy decision that each state does have to make to start the process is governance structure. The NAIC model basically says, you know, there are different options under the law, that you can have a state agency do it, you can have a nonprofit do it, you can have something in between like a quasi-public authority with a governing board. All of those are allowable models. They illustrate the fact that generally under this law, the states have lots of choices and lots of flexibility to do what fits best in their state. And so, for instance, Utah does have a state agency in the governor's office that is in charge of their exchange. Massachusetts has that quasi-public type of authority called the connector. But that governance issues, we can come back to that in questions, is the one thing you have to decide. Once you've done those two things, basically the authority and the governance structure, all kinds of second-level issues come to the fore. Should the exchange do markets employers up to 50 or up to 100? That's a choice the states have for the first couple years. Should you blend the individual and small group market? Maybe you want to blend administratively but not the risk pools. You could do both or neither. There's all kinds of choices like that to be made. But my general advice on that, and as I've talked this through with different states, is that those are kind of questions that have a lot to do with the details of your own state market. And probably the best thing to do this year is to say, gee, we don't really have to decide that yet. We've created a governance structure. Maybe we ought to let these people who are going to be the governing board look into the issues and bring us back, a report on this next year. It's the proverbial, let's study the issue for a year type approach. And here it makes eminent sense to take those issues that aren't on any particular timetable this year and give the new governing board some flexibility. You may decide in the end that you want to give flexibility in the long term to the board. I mean, these exchanges, I think, work better the more entrepreneurial they are and the more they're not, kind of tied in under a set of kind of rigid requirements that make it hard for them to adapt to the marketplace. They are, after all, out there selling insurance, competing with private insurers to attract buyers, especially the ones that don't have subsidies. So that's kind of a basic overview. Let me give you a couple more timeline issues, and then we'll throw it open for questions. And I can be on until about 11:30, so I'll finish my part, take questions, and then Barb Menard from my staff, who knows much more about the details of all these things than I do, will be on for that last half hour to answer questions as well. So where are we with the states kind of in terms of timetable and moving forward on the process? Back in August, we put out an announcement that said every state was eligible for $1 million, up to $1 million in planning money to look at developing a state-based exchange. We were very gratified that 48 of the 50 states, plus the District of Columbia, took up our offer, and those 48 states and the district are now moving forward on their planning grants. States are at various levels of planning under those grants, but 48 of the 50 states are, in fact, working under planning grants today. The 49th state, by the way, Minnesota, is now applied for their planning grant as well. They had a change of governorship, and the new governor said, top priority for me is to look at these advantages of an exchange and see whether it makes sense for Minnesota. So that we're still reviewing that application, but we hope to award that in the near future. The only state left is Alaska, and therein lies some of the difficulty and challenge of these exchanges. You take a state that's fairly remote, has a very large geographical area, a very small, comparatively speaking, population. That's a more challenging circumstance in which to develop an exchange than would be true in many other states. Now, we'll get to an exchange in Alaska, whether they do it themselves, we still hope, or whether they end up part of a regional exchange, maybe with Washington or something, or whether we have to put up a federally operated exchange. That's what the law calls for as a backup to if the state doesn't do it. And this is another thing that gets some states, gee, I wasn't that interested, but now that I know there will be an exchange and it will be federally operated if it's not operated by my state. As I quote Governor Barber on this sometimes, he says, I don't really like this federal law, but if there's going to be an exchange in Mississippi, it's going to be a Mississippi-based exchange, not a federal exchange. So if that's the motivation for people, that's fine too. That would be another reason to do a state-based exchange. At any rate, so we got 48, now 49 states pretty soon working towards their exchanges on a planning basis. In January 20th, we announced the next stage of this, which we called establishment grants, which is about implementation, moving from planning to implementation. And there we're offering states two different ways to come in for their implementation plan. One for the states that are really ahead of the curve here, ahead of the pace. They can come in for full multi-year funding starting in the first application is March of this year. And if they've got the right building blocks in place, they have the legal authority to do an exchange, they have a governance structure, they have a budget through 2015, they have the consumer assistance that's necessary to make the exchanges work. If all those pieces are in place, you can get multi-year funding. Most likely, very few states are going to quite be there as of March of this year. So the next alternative is the second type of funding, which is yearly funding, and they're up to a year worth of funding, and their states can take whatever kind of bite-sized chunks of the exchange implementation that they want to. There are 11 different areas in that grant announcement, everything from stakeholder consultation to IT development to integration of the insurance and Medicaid offices to financial reporting requirements, etc. States can pick and choose among those areas and propose to us, a very small grant to do a set of advisory committee meetings and some public meetings under stakeholder consultation. States that want to take a big chunk of the IT on now could apply for millions of dollars for that. There's a range of opportunities. States can come back as often as every quarter for the next year to apply for additional funding, and by next year, by 2012, first half of 2012, all states do need to be moving into that multi-year funding track because the Secretary does have to decide by January 1st, 2013, which is less than 2 years away now, whether a state is in fact equipped to do its own exchange. Some states may choose out, some states may just not make the grade, but that decision gets made in less than 2 years. And so time is of the essence here, which is why the law, are you required to pass a law this year? No. You could conceivably do it in the first half of next year, but if you weren't doing some other planning, you're likely to be, in a pretty difficult spot to meet the standards that are necessary to get certified by the end of 2012. So that's kind of basic lay of the land. I think with that, I'll stop because it's always more valuable for me and hopefully for you too to have questions and see what kind of issues people are wrestling with. And if you got a question, no matter how simple and dumb you may think it is, it's probably a question that many other people have too. So feel free to ask them, and I can be around for I guess about 15 more minutes to answer questions. And I may need to call on Barb during that period, and then after that, she can be on for another half hour answering questions.
Thanks, Joel. I think you made a couple of very important clarifications. One, just that the funding for establishment and planning is fully funded through the federal government, and it's also automatic, so not subject to the budget debate that's going on right now. And then also that the actual, the kind of load that a legislature needs to carry in this session is pretty minimal in terms of just putting in some sort of model language and setting up a governance structure. And I think that's important because this is all playing out in a political context within state houses. And you've got a lot of new legislators, a lot of legislative leadership who have deep concerns about the Affordable Care Act and are tuned into the national debate. And if this were something that required a cost hit for states or a deeper kind of commitment to implementing something, it would be a harder lift to carry. But it sounds like with a few relatively easy measures, states could at least put a placeholder down and then decide later, based on whether the Affordable Care Act stands up to legal challenge and the interest of the state, as to how they want to structure more deeply their exchange participation. And that leads to our first question, which is, we've got a question from a state official who wants to know that if the state basically if the state decides to allow the federal government to play the role in exchange formation right now, can they come in later and establish a state exchange, or is this their one chance to do it?
We've heard that question a lot, and so we've asked the lawyers, and the lawyers have basically told us that we have flexibility on that question under the federal law. So we don't have to say to states, if you miss the January 1st, 2013 cutoff, you are forever precluded from establishing an exchange. The law would allow us to have states get some flexibility to come in later. So we are exploring that issue. I'll just give you the real-time thinking on it, which is on the one side, we like that because we do want, these exchanges are going to work better if the states do them, if they own them. Every time I go out to a state with staff that haven't really been out to the states and don't have the same kind of, in their bones, kind of understanding of the state markets that I do from 15 years as an insurance regulator, I invariably hear, gee, there really are some unique issues about this state, and maybe there are unique issues about every state, and yeah, this whole idea of state-based exchanges makes a lot of sense. So we're going to be in favor of trying to do that, and that's our starting point for allowing that flexibility. On the other side, as we talk it through, is this notion that we can't really afford to, put all the resources that we'll have to put in to establishing a federally operated exchange in the state. That does require us to go out and deal with some of the same people that the state would have to deal with. the carriers are not, we don't live in a world in which all the carriers are national carriers, so we have to deal with those markets. We have to deal with local delivery systems, et cetera, et cetera. So if we put in all that effort and all that cost and then say, okay, well, now the state's going to switch in and do it, 6 months later or something, it starts to become expensive for the consumers of that state to be switching back and forth. So then there has to be, some kind of process here that we'll have to balance out these different things. So my guess is that, we will do everything we can to come out with some flexibility for states after January 1st, 2013, but it's probably not going to be like you can come in whenever you feel like it. It's probably going to be something much more, patterned than that.
Okay. And a related question to that, what would a federally operated exchange look like, and how the policy decisions related to that exchange, where would they be made? Would that be in your office there?
We have to think through some of that, but right now we are, same way states are, fairly early in the development of those ideas. It's like, the states that are on the phone, if I ask them, tell me kind of exactly how your exchange is going to look and how you're going to do things in 2014, most likely people say, well, we're just kind of looking at the different options still. We're barely started to flesh out the options, much less make final decisions. So that's basically the stage we're in, too. We understand our obligations. We're prepared to meet them, but exactly what shape that'll take, probably the best thing I'd say today is, if you think about how the state markets work, whether the federal exchange or a state-operated exchange, if either of them is done correctly, the people of the state will get good choices that they don't have today. They'll have more insurers in there. They'll have a better set of benefit choices, easier ways to compare them, all of those kinds of things. And so from the consumer's perspective, it probably wouldn't be readily apparent who's exactly, behind the curtain running the show. Both the states and the federal government would have more or less the same objectives. So I don't know in the end that it's that much different, but if I was a state, I'd still want to be in the driver's seat to making all of those decisions myself rather than depending on the federal government to get it right in a variety of states around the country.
And, we've got another question on the same subject. A federally operated exchange, how would it be financially sustained? Would it be assumed to be based on assessments the same way the state-based exchanges would?
Yes. So the users, the consumers of that exchange would pay for it whether it was federal or state. The one difference there is that a state has the flexibility to do something other than some kind of user fee. I think most of what you hear talked about is some kind of assessment on premiums. Typically, people say Massachusetts about a 3% load, something like that. That would typically be an option, at least, that people would be looking at. But the law does allow a state to be more creative than that. The law would allow for some kind of assessment on providers or even, use of general funds. I know that's kind of, a bad joke these days with the budget crises we're in, but there is the option to have funding mechanisms of pretty much any sort that the state wanted to, beyond just a kind of user fee type approach to fund the exchange. And the federal government obviously wouldn't have that same flexibility to set up some kind of broader funding within a state. They could cooperatively, I guess, with the legislature, but they wouldn't have the authority in the first instance.
Great. And we've got a couple of questions on regional cooperation, which I know in the past, Joel, you've mentioned the South as a place where you could potentially foresee some regionally cooperative efforts. The first question is just if the southern states chose to work together on a regional exchange, how would the federal funding for implementation grants work? Because I believe right now it's kind of an individual state mechanism. Would they need to band together and come together with a regional proposal?
Yes, they would. The funding flows to states, so the individual states would have to seek it for themselves, but presumably each of them would seek some funding as part of a cooperative venture, and there may even be a lead state. We have that a little bit. We have some early innovator IT grants coming out fairly soon, we hope. I saw in the press yesterday, so I can just quote what was said in the press. Massachusetts announced that they're the lead state for a consortium of the New England states around the IT work, and so they're the lead state, but all of the different states in New England are part of a consortium with them to participate in that IT funding. That same kind of concept could be enlarged upon through a group of the southern states. And being a former Duck and a diehard Duck fan, if the SEC, I call it the SEC consortia down there, if you guys can do an exchange as well as you can play football down there, you'll have a bang up exchange down there in the South. So it's possible to put one together. I think what you tend to find when states talk about this, though, is there's enthusiasm for it. There was in the South. There is in New England to some degree. There is in the western states to some degree. It ends up being something that the states say to do a full partnership, one exchange where we're all in together. Ends up being something where the legislatures of the various states say, gee, that means that we're giving up a lot of power over our marketplace, and we think we know what's best for consumers in our state. Even though we like Georgia or Alabama, whatever, if we're Mississippi, we like to be in charge of those things. So you end up kind of falling back, I think, more to let's talk about cooperating on certain dimensions of the exchange. I mentioned Massachusetts on an IT function working with the other states. So you kind of divide the exchange into different component parts and think about where does it make sense for us to cooperate and where does it make sense for us to kind of have our own autonomy and ability to have the exchange adapt to our local circumstances. I think those kind of models are more likely, but the statute does envision a full-fledged regional exchange if that's what states want to do.
Okay. Related to that, we've got all these discussions about the sale of insurance across state lines that are part of the national debate. If you were successful in getting over the kind of sovereignty concerns of joining a regional-based exchange, would that allow you to create a larger risk pool where you would, in essence, the SEC exchange, if that were to be created with some subset of southern states, would that allow for the sale of insurance across those state boundaries and a kind of regional-wide risk pool?
In concept, I think the answer to that is yes, but in practice, I think there's a number of pretty difficult obstacles in front of you, starting with the insurance industry, which tends to see their market state to state and pools of risk on a state-to-state basis, and they would probably, be very interested in the rules being exactly the same across all those state lines before they would be comfortable kind of talking about, serving a market where there were different rules. That's one of the issues with these exchanges, by the way. Having different rules inside the exchange and outside the exchange tends to create opportunities for mischief and adverse selection, and having states that are together but have some rules different will tend to create those same kind of circumstances. So I think combining into a big regional risk pool does carry a lot of those risks. And I did see, I don't know if Mike or any of the folks from Mississippi are on the phone. I saw that Mississippi had passed that law that at least one branch of the legislature that said, you can buy, Mississippians can buy insurance from any place in the country that they want to. But it raises a couple interesting questions to me, one of which is how many people in Mississippi really want to buy a policy, say, out of Oklahoma or California, where the insurer basically has a network in those areas, but not necessarily a network in Mississippi. If they already have a network in Mississippi, they probably actually have a license in Mississippi, too, to serve that market. Otherwise, you kind of have, you have like the situation I have. My family lives up in Pennsylvania. I'm working down here in D.C., and every time I need to go to the doctor, I have to figure out how to get home to Pennsylvania to do it. So there are network constraints on sort of broader risk pools and broader coalitions. But it's possible to get through that, and so certainly we're interested in exploring that if states want to explore it. Great.
Last question for you, Joel. I know you're busy, and then we'll turn it over to Barb. The governance structure that states create, this is one of those things that is going to have to be done in the short term. And will the federal government weigh the governance structure that a state develops in enabling legislation? Would it, will this be something that has to be certified? Because if so, then it sounds like there's probably some guidance that needs to go out to the states as to what needs to be in that governing structure.
Very good question. There's a lot of federal dollars that flow through these tax credits to the states. So the federal government does have an interest in making sure that there's an accountable governing structure, and that tends to mean a couple things. One, a lot of transparency. The law does require a lot of transparency about how the exchange operates and disclosing, operating costs and different aspects of performance around the exchange will be important so that there's accountability through transparency. Second type of accountability is just pure financial accountability, good records, and anybody's been in the insurance business, when you handle the kind of money that gets handled in the insurance business, and particularly since you're collecting money on the front end and then spending it on the back end, you want very strong financial controls over the process. So that's a second set of issues. But these are all things that states are used to. And then the third issue is conflicts of interest, to make sure that the board is properly constituted. And this, by the way, only becomes an issue if you have a state agency. Then you already have the accountability, you already have the financial controls, you already have the whatever transparency there is in that state. Typically, there's a lot around government. But if you go to the quasi-public or the nonprofit, then you have these concerns, and you have the conflict of interest concern about whoever's going to be appointed to be on a board, whether it's a quasi-public or nonprofit, or what kind of conflict of interest standards do you want. But I use this as a good example of the need for us to be nimble, because there may have been, a number of people within my shop who were saying, well, the easy conflict of interest rule is that you can't have anybody who's an insurer on the board, and you can't have anybody who's an agent on the board, and you can't have anybody who's a provider on the board, and you can't have anybody basically who has any selling capacity, any financial interest in the health insurance marketplace on the board. So that's, that sounds like a righteous position. But then the story I like to tell is I was in California, and they said, well, we wrote pretty broad conflict of interest rules, and now we're having trouble finding people to appoint to the board because we feel like we're limited to academics and retirees because of the broad conflict of interest rules we have. And if we want people who actually know something about health insurance, they typically have some financial connection to the industry too. So that was one thing. And then we talked to the governor of Washington, and she said, yeah, those same issues are tough for us, and we're trying to figure out how to deal with them. And then we talked to another one of the states that was working on all this, and they said, yeah, we're thinking of a model where, we definitely don't want, somebody with a financial interest to dominate the board, but we're thinking that maybe you have different segments of the board, and you make sure that, there's different rules so that nobody with a conflict issue is in a commanding position on a decision. Point of all that is that these things get pretty complicated, and so probably as we go forward, we think more in terms of, a broad policy that says the state has to have a conflict of interest policy that has to take account of all these issues, but don't try to prescribe a certain type of approach, even on that tough issue. So, the answer is yes. We will have concerns about what that governance board is. States would be well advised to look at the guidance we've already put out to think about all these issues, but most likely, in the end of the day, if we want the exchanges to work, the guidance, the actual regulations are going to tend towards, standards around those issues rather than really tight prescriptive rules that would straitjacket the states.
Joel, we really appreciate your time, and we're very lucky to have you in your position. Obviously, you're fresh from the state of Pennsylvania and still have your family back there, and we really appreciate you continuing to focus on the states as your core audience in your new brief. Thank you so much for your time.
Well, thanks for having me, and Barbara's got a whole staff of people that she'll answer some more questions for you today, and then as she'll tell you, we have people working with each of your states, and we continue to have a top priority be to do whatever we can to answer state questions, to be a resource to the states as they try to wrestle through these issues. And let me just conclude one last thing, Chuck. You did a really good job of underscoring the key points that I made before I started with the funding is from the federal government, and the lift isn't that big in the legislature. The third thing that I want to underscore to conclude with is this is a naked appeal to the people out there who say, I just don't really like necessarily what the federal government's doing with all of this, is that bottom line reality that if you don't do it in your state, and the law doesn't change, and we have no reason to believe it's going to, I think the legal arguments are not very good for striking this law down, could happen, but if it doesn't happen, you will then be faced in 2013, or will be faced with having to put a federal exchange in your state. So if you don't like the federal aspects of this, you have the opportunity to take control of it now, and I hope that if that's the motivation you need, I hope it's enough to get you to do it.
Thanks again, Joel, and I appreciate Barb and Jen and Lisa for being on the line. Barb, one of our next questions is cutoff dates. You know, what is the final cutoff date that a state legislature has to pass the model law, the NAIC model or something similar to it, in order to keep from kind of being in default and having as Joel mentions, the federal government take on that role of creating the exchange?
Yeah, it's a good question, and I'll answer that a couple of different ways. One is that we're encouraging states to do that sooner than later, because one of the most important things that states can do is to establish a broad framework for the exchange that then can start making some of these more specific decisions and start doing some of the IT development and flowing the grants through them. So the earlier the better is what I will say. But really what it's tied to is being able to apply for what's called level 2 of the establishment grant. We have an establishment grant funding opportunity announcement on the street right now, and what we've done is we've divided it up into 2 different levels. Level 1 is if you've gotten a planning grant and you just want to come in and apply for a little bit more money, move the ball down the field further, you can come in as a level 1. But to apply for a level 2 establishment grant, you have to have your exchange, you have to have the legal authority for the exchange, which is either through legislation or an executive order, some type of legal authority, and you have to have the governance structure for the exchange set up. The latest application deadline we have right now in our funding opportunity announcement is March of 2012. So while we're encouraging states to do it in this legislative session, we understand that some might not be able to get to it till next legislative session next year. And for those states that are doing that, they can come in and apply as late as March 2012 for that level 2 establishment grant. But again, earlier the better, so you get the IT systems going and you're not missing key deadlines moving down the road.
So March 2012 is your hard and fast drop-dead date, but you'd have to have everything wrapped up in a bow by then. So definitely, with legislative sessions often beginning late January or so.
It's tricky. It really is
tricky.
And we understand that. We felt like we couldn't, in good conscience, go any later, because the later you go, then IT systems and all those pieces that need to be getting going, it's just going to be too late to be able to flip the switch on 1/1/2014.
And we've got Texas on the line today, and certainly they're this is their session to get it done on their biennial.
Correct. Yeah, we have 4 or 5 states that are like that, so that is correct.
Great.
But again, keep in mind that it doesn't have to be legislation. If you can do it through some other legal authority, Indiana did an executive order, so there are some other ways to do this. Most of the states will do it through legislation.
Great. Another question on a different theme. As long as the plans on the exchange meet the minimum benefit requirements, are states able to prevent certain services from being covered on the exchange plans? And related to that, how flexible will the standards for plans coverage be from year to year?
Okay, that's a multiple-part question, and it's fairly complex. I'm going to try to answer it. Can you just repeat the whole thing for me?
Yes, and why don't we just break it into chunks?
Sure, that'd be helpful.
The first one, as long as the plans on the exchange meet the minimum benefit requirements, are states able to prevent certain services from being covered on the exchange plans?
Okay. What that question relates to, from what I understand, the way it's being asked, is meeting the essential health benefits vis-a-vis state-mandated benefits. And right now, that's kind of an open legal question. So if the essential health benefits package comes out and doesn't include certain benefits that are mandated by the state, can the state prevent those from being in the exchange? It's an open legal question right now as to whether the state can do that, or if they will have to have all of the state-mandated benefits in there, which, as you know, under the Affordable Care Act, if they're not in the essential health benefits package, will have to be paid for by the state. So that's something that we're looking at right now. We're pre-rulemaking on that as to what's in the essential health benefits, and we don't have a hard and fast answer on that. So I'm not dodging. We have to keep you posted on that, and I want people to check back in because that's a good question.
Okay, and the second half of it, how flexible will the standards for the plan's coverage be from year to year?
I think we're going to try to allow as much flexibility as possible, but keep in mind that we're going to have an essential health benefits package under the law that plans have to meet once that's designed through regulation by the department. So that is statutorily required by the Affordable Care Act. We will be putting out regulations on what is in an essential health benefits package, and then states will have to meet that. We're going to be as flexible as we can for the states, but there will be a floor that states will have to meet.
Okay. Are there any federal requirements pertaining to purchasing rules in state-operated exchanges that have been promulgated to date?
Nothing yet. I think the first regulations that you're going to see come out around that area are going to be in the late spring of 2011. That will be in the form of a notice of proposed rulemaking, probably with final rulemaking after extensive notice and comment in the fall. And again, that's an area that we're probably going to be leaving a lot of flexibility to states, but we're pre-rulemaking on that, so I don't want to say too much.
Okay. On a different theme, are there any plans to use the health insurance exchange system to expand health information exchange efforts?
Well, one of the things that we want to do is we want to coordinate with the with our Office of National Coordinator and making sure that we're coordinating with the grants that are going out, the HIE grants that are going out. So we're trying to do a better job of that at the federal level. We are encouraging states to do that at the state level, but that is something that we are starting to develop. And Lisa, I'm not sure if you had anything you wanted to add to that.
Okay.
Okay.
All right. We've in previous calls had questions about interactions between the insurance exchanges and the Medicaid expansion, and we have a question along these lines. What states have set up MOUs between the Department of Insurance and their Medicaid agency? Do you have any sense of how many states have already set up an MOU that would help link up the Medicaid kind of screening process and the vetting process for the exchanges?
It's a good question. I think to date we haven't seen any yet, but I can go back and double check on that and get you information if there is. I don't think we've seen any yet, but you will see in our funding opportunity announcement that that is a requirement. It's a benchmark in our Level 2 grant. So it's something that we are asking states to formally do, is to set up a memorandum of understanding between their state insurance department and their state their state Medicaid department. We've seen across the states, and this will come as no surprise to anyone on the phone, that there tends to be a lack of communication between those two entities, and really heretofore there hasn't had to be as much communication. But the way the exchanges are being designed with no wrong door, we want everyone to come in through the same portal. We really do need that direct communication at the federal level. Everything that we are doing when we're designing our regulations and our guidance, we're doing hand in glove with Medicaid. Joel is constantly working with Cindy Mann and Penny Thompson here and others, and we're encouraging people at the state level to do the same. So that's a requirement down the road. I don't think I've got a model yet, but I will triple check on that and get back to you.
And since we've got a question about models, we've got another question just in terms of best practices. Is there some sort of portal or web-based resource run by the department or one of your outside partners that you would advise our participants to go to?
Yeah, we are developing one that we hope to have online within about a month. Right now, one of the best portals out there is NASHP, which is the National Academy of State Health Policy, has a portal on this, and Robert Wood Johnson is also tracking the activities in the states. So both of them have web-based resources, best practices, what states are doing. NASHP actually has a listserv that people can get on. I believe it's called the Exchangers, and people are putting out questions and answers on that. That's very helpful.
Great. We've got a question about the Utah model that's received some attention. It seems that when we talk about exchanges, it's often Massachusetts and Utah. And the question is just simply, does the Utah model meet the standards now? So if a state decides to go down a road that looks an awfully lot like Utah, will that meet muster?
Yeah, it doesn't quite yet, but it is very, very close. And what we are saying is that the ACA is a broad enough tent that it will encompass both the Utah and Massachusetts model. So there are probably a couple of tweaks that they're going to have to do once the final regulations are out. So I can't tell you specifically what needs to be done yet, but it is very close, and we do think that the Utah model will fall under the rubric of the ACA at the end of the day. So
conceptually, that kind of mainly a Travelocity-like feature with a few tweaks is something that would fall within the tent.
Very much so. I mean, you're going to have to look at what the essential health benefits package looks like, what our quality rating system is when it comes out, that kind of thing. But it won't be too far off the mark. If you decide to go the Utah model, there won't be too many changes that you'll have to make.
Great, great. Well, I believe that's our last question here. I'm going to double check real quick. We do have a question on risk pools again. Just a second. Will they be using risk pools from multiple states or just in jurisdictions of the exchange where the plan is being sold? And that's concerning multiple state plans operated by OPM. And what risk pools will the multiple state plans be utilizing?
Wow, that is a question that I don't know the answer to. So I will have to double check on that and get back to you, because that is being handled by OPM. And I haven't been that intricately involved in those conversations on the national plan. So let me get that answer and get back to you.
Well, great. We will email you the specific question content so that we get it exactly right.
That would be very helpful. I would rather do that than give you the wrong information.
Great. Would you like to make some final points, Barb, before we sign off?
The only other thing I want to say is thank you very much for everyone that's on the phone. We are very excited about this work moving forward. Joel and I spend a lot of time traveling around the country and talking to state governments. There's an enormous amount of enthusiasm out there around this idea. And, you know, again, we want to say that the ACA is broad enough that people can come under it with a Massachusetts model or a Utah model. And really, if you look at the two, there's not that much light between them. We have a whole team of people here, project officers who are working on the grants. We have a technical assistance team that stand ready to answer any questions that you might have. So in a minute, I'm going to give you my email address so people can answer them. I encourage you to work with some of these outside groups like NASHP and RWJ that are doing great work in this space. But we want to do everything that we possibly can to help states move the ball down the field towards establishing their exchanges. Our ideal world is there's not a federal exchange. We have 50 states doing these exchanges, and they're laboratories of democracy, and everyone is doing it in a way that it works for their markets and their individual states. And we want to help states get to the point that they have these exchanges up and running and people are able to access quality, affordable insurance under the exchanges in their states. So my name, again, is Barbara Menard, M-E-N-A-R-D, and the best way to get me is via email, which is B-A-R-B-A-R-A .Menard, M-E-N-A-R-D, at hhs.gov. And if you have any questions about funding opportunities, if you have any questions, technical assistance you need down to the specifics on issues that you're struggling with, if you want to be hooked up with someone from another state who has done good work in a certain area, I encourage you to contact me, and I will try to be helpful with that as quickly as possible.
Barb, we did get one last question that came in under the wire.
Okay.
Will the federal government be advising states as to whether or not to require Medicaid health plans in the exchange?
That is probably something that we're going to leave to state flexibility, but you know, on the technical assistance side, we can help states think through maybe some of the pros and cons to that. But as with all of these issues, we're probably not going to take a side. So, you know, a lot of the questions you say, what should we do? We'll help you think through for your individual markets what might be some of the implications. But as this is a state-based model, we really want to leave these decisions to the states.
Great. And I think that's a good note to end it on. There are a bunch of big decisions that states are going to be able to make a year down the line in terms of whether you have an individuals-only exchange and a small group exchange separate, whether you merge those, whether you allow the exchange to be opened up to large businesses. You know, there's a study out by RAND that says that if every state were to open up their exchanges to all size businesses, not just the 50 employees or below or 100 employees or below, that 139 million Americans could end up getting their insurance through the exchanges. So these are huge decisions.